Okay, you are a senior house officer on call for emergency general surgery admission. A 10-year-old girl has just been admitted as an emergency with peritonitis. She has been unwell for 2 days and very unwell for one. The child is extremely ill. A perforated appendix is suspected and she is being resuscitated by your registrar before being taken to the operating theatre. Your consultant, Mr. X, is on his way from home and will perform the operation. You have been instructed to see the child's father and explain the situation. You do not have an opportunity to see the child before she was taken to theatre. Okay.
Yeah. So Christopher, let me just say something to you. So, did you watch the lecture or not?
Unfortunately, I was working yesterday, late last night, and it's very
It's
early
fine.
by me. I wasn't able to look at the lecture.
Not to worry at all, not at all. So basically, what I want to say is, you need to, like I said, even in the lecture and also in the lecture as well, you need to memorize the scenario, or at least know it very well. Okay, so that will make
Okay.
it very easy for you in the exam.
Right.
In the exam, you will not have this much of information written to you in a STEM. You will have a single line saying "discuss with father," all right, and
Okay.
then you will have to read and find out about this information, all right.
Right.
But basically, that's fine. I think you'll be able to do well anyway. So let's go and start. Start when you're ready. Okay.
Okay. Yeah, sure. Good morning, sir. My name is Dr. Bufong, and I'm one of the senior house officers at the facility. I understand that you are the parent of this patient. Can I confirm your name and yes? Can I
Hi,
confirm your
hi,
your
I'm Abdullah here. I'm the father of Leslie, and I'm just quite worried, really, doctor. I feel really guilty. I feel that it's purely my mistake. This morning I left her and went to work, and she was in pain. So I'm just quite worried about her. Are you able to update me if that's okay?
sure, sir. I want to just assure you that I will try to explain what's going on, and I hope that at the end you will feel a bit more comfortable. It's okay to be concerned, but I hope you don't feel too worried. All right. So, can you explain to me what you know about your daughter's situation at this point in time?
Well, all I know that I was told this morning that she had a severe abdominal pain and she had to attend to the A&E and understand that she's going for surgery. And I feel that I'm the reason why she's going for surgery because I left her this morning.
Okay. Well, okay. So, by chance, do you remember for what period of time you thought she was ill for?
Well, last night she started to sort of complain of tummy pain, um, but it wasn't bad enough that we would go and seek medical advice. We just thought that it's the normal pain that she gets after she eats.
Okay.
But yeah, so that was
Okay.
the first time she complained of that.
Right, no problem. Well, the thing about it is that for your daughter or for children, having abdominal pain, especially if they feel unwell, can be a very concerning medical problem. And essentially, based on our investigations, most likely we are suspecting that your daughter's having an inflamed appendix. And how we deal with this problem is via surgical management, where we would want to remove her appendix in order to improve her overall medical condition and potentially prevent her from suffering from a life threatening condition, what we call sepsis. Okay? By chance, have you ever heard about an appendicitis before?
Well, I know what appendicitis is, but and unfortunately, my father had appendicitis and an abscess recently, and he died. So that makes actually me very worried about the operation now.
Okay.
But can you tell me, is it definitely appendicitis in her condition?
Well, at, at this point in time, I haven't seen the patient myself. My senior registrar, he's currently with your daughter and he's currently stabilizing her, ensuring that she is healthy and fine and fit for the operation. But based on the discussions with my consultant as well, they highly suspect that she's having an appendicitis. And with regards to how overall management and treatment, they would want to physically examine the appendicitis, and if they realize that it's inflamed or infected, they'd want to remove that source of infection, which potentially would be the inflamed appendix.
Okay. Fine. So we don't know yet. Fine, but you're basically doing it to diagnose it. I do understand that, but what are the risks of the surgery itself?
See, can you repeat your question again?
What are the risks of the surgery?
Okay, so there are many risks involved in this procedure. Okay, one of the risks is that, one, for sure, she's going to have a cosmetic scar on her tummy. I can assure you that this scar is going to be, we're going to try to make the scars as small of a defect as possible. Okay, now accessing the layers of the tummy, there can be some bleeding, right? Based on the procedure, if there's any bleeding, we will be able to address the bleeding and ensure that, it's not persistent. Okay. Also, there can be damage to the bowel in inspecting the large and the small intestines as well. Right. If this happens, it can be surgically managed as well. There's also a risk that if there is an infection, the infection can spread. However, we'll be covering her with antibiotics. And these are the major risks of the procedure. Also, there may be some anesthetic risks as well. However, the anesthetist, I can assure you that they may have a discussion with you and address any potential red flags. And also, there's a very small risk that the procedure can fail. However, it is my consultant who's a very experienced surgeon doing the procedure, and I can assure you that he's competent in ensuring that your daughter can do.
What's the consultant name?
The consultant's name is Mr. X. All right. Now, once you're hearing me, sir.
Can you say
Hello?
again? What's the consultant name?
The consultant's name is Mr. X.
Okay. Well, I'm quite worried now, really, because remember that consultant operated on my father 3 months ago, and my father died from the operation. Really,
Right.
he had a perfect, and I'm quite worried.
Well. So the thing about it is that this is a case by case scenario. The presentation and the comorbidities or the risk factors for everyone coming to surgery is different, and I'm not sure potentially what may have been your father's risk factors, right? I can also say that I'm not sure what are your daughter's risk factors as well. What I will say is that at this point in time, your daughter, she is currently in a life-threatening situation where, if the procedure is not done, there's a risk that she can become septic and she can die. So this operation is really to assist in saving her life.
Yeah, I'm not objecting to the operation, of course. By all means, the operation needs to happen, and I totally support that. But I'm just worried
Yes.
about that particular consultant. Are we able to change the consultant for me?
Well, so unfortunately, at this time, I am not sure of any other consultant that may be available to assist your daughter in this specific moment in time. What I could assure you of is that this doctor is a consultant and he is very well capable of doing this procedure. And if there are any problems that need to be addressed, I'm pretty sure that we will be able to address, and most likely your daughter will be able to be successful in coming through the surgery. At the end of the procedure, we would want to monitor your daughter, ensure that all of her vital signs are under control, and we would want to monitor her progress.
Okay, that's
So,
fine. Will she be able to
yes.
get pregnant again?
Well, at this point in time, would not be able to say no. Your daughter. You asked if will she be able to get pregnant? Yes.
Yeah.
Okay. Well, so during the operation, there may be a risk that there could be damage to the ovaries and the fallopian tubes. However, based on the location of these structures, the risk of damaging these structures are low. So I'm not ruling out entirely that yes, I'm not saying that yes, for sure, your daughter will be able to become pregnant. However, what I'm saying is that this is a very low risk, and even though it's a very important concern, I don't think that you should worry too much.
Well, I'm not worried too much. I'm just, adequately worried, let's say.
Yes.
Yeah, that's fine. Okay, thank you, doctor.
So, well, it was nice having a chat with you. Just to summarize, it's just for you to understand that your daughter is not well, okay? Based on our assessment of her, she has an inflammatory slash infectious process in the tummy area, and we think that solving this problem would be via surgical management, and we're suspecting that she's having an inflamed appendix, okay? And if we don't do this procedure, she can develop sepsis and potentially die. Are you okay and understand everything that we would have discussed
Yeah,
today?
we can go ahead and consent. Am I able to consent for her?
Definitely, yes, you would be able to consent for her. Yes.
Okay, that's fine. I know this is not going to be part of the exam, but what type of consent are you going to make for this patient?
Pardon?
What type of consent are you going to do for this patient?
Um, I honestly, I don't know the name of the consent.
How many types of consent that you know? Do you know any type of the consents?
I know there are four. There are four types of consents.
Mm-hmm.
I know that there is one consent where it's done by the two consultants.
No, not necessarily. Does anyone know the answer to that? What type of consent are you going to use? Pediatrics?
Jehovah consent?
Can you say again? I didn't hear you.
Jehovah consent?
No, sorry, I didn't get that. Can you say again, please? Slowly.
Jehovah's consent.
No, Jehovah's consent. No, not at all. Why would you do Jehovah's here? Jehovah's is basically for those patients who refuse to take blood transfusion. Um, anyone know the answer? So Bav is around. Bav, you work in the NHS, don't you?
Sorry, I'm driving, Dr. Stella. Just one
Okay, that's fine. No worries. Okay, fine. All right.
yes.
So basically, we have four types of consents, right? Four type of consents. Consent type 1 is for adults who have capacity. Okay. Consent type 4
Is
for.
consent 2, is it normally for children?
Can I say again?
Is that consent form 2 for children?
Correct. Yeah, you're gonna do consent form 2. Consent form 4 is for adults and youngs who don't have capacity, or basically unconscious or confused and unable to sign and unable to understand or weigh the options. So type 1 for those who have capacity, for adults who have capacity, and type 2, type 4 is for those who don't have capacity, and type 2 is for children. Okay, and it needs to be signed by those who have, basically their mother or whoever is in a parenthood responsibility, starting by their mother first and their father will be next. Okay. And then consent form 3 is basically for children or adults that do have capacity. So children, if you have a child, 14 years old, but they have capacity, you can sign a consent form 3. Okay. Fine. I mean, obviously, this is not part of this scenario, but can be asked somewhere else. I think it can be asked in the procedures. You know, the scenario for in the procedures in arranging the theater list. You can be asked to define a consent. What is a consent? What are the types that you know, and what are the differences between them? So you need to know that. Okay. Fine. So, Christopher, what do you think of your performance in this scenario?
It was a little bit difficult. I just need to familiarize myself with the actual scenario and practice.
Yeah, I think so. So in terms of your introduction, it was okay. It was a little bit slow though, so I would go into it directly, very quick. You know what's happening, so just go directly into it. The thing is, which I mentioned like twice or three times, I kept saying I feel really guilty. I'm the main reason. So at least you need to acknowledge this and sort of reassure me that I shouldn't be feeling guilty. So basically, you would say, well, I appreciate that you're worried about your daughter, and do understand that you do feel guilty about this, but I don't think that you were any reason to cause her appendicitis. Most of the times, we don't know the exact reason, and it's very common at this age group. And of course, we don't know yet if it's confirmed or not. So I would advise you not to feel guilty as you're not really a particular reason for this condition. And the other side, she's currently in safe hands, will be able to operate and get her sorted, right? That's one thing. Is it definitely appendicitis? Your answer needs to be clear cut here. If you keep, circling around, you're not going to really take the mark. You want to make it very clear. You say, I wouldn't say definitely, but it's likely appendicitis. So it's one of the difficult diagnoses to confirm, but we look at many factors. One, it's common in this age. Two, the presentation is somehow typical. Three, we can't really tell that it's definite until we do the operation and actually have the appendix out and see that it's actually inflamed. All right. What are the risks of the operation? I think you've done the combination here, which is good, but you need to signpost me. All right. You need to basically, like I said, use your voice to stress in certain points and ignore certain points if you wish. All right. So you want to say there are the risks of this operation. Of course, it's an operation, so it carries risks and benefits. There are going to be some small scars. This could be 3 tiny scars, each measuring about a few centimeters, like 1 to 2 centimeters. 2, there is risk of this. I mean, just use your voice to sort of point out what's the actual risks. I want to end the consultation and your patient actually remembers the risks of this operation. Okay. So you want to take your time doing that. There will be 3 small scars. Will she be able to get pregnant? Again, your answer here, you kept fiddling around. You didn't give me a clear answer. So you want to say, well, this is a very important point that you just mentioned. And thank you for bringing this up. Infection might lead to adhesions between the tube, and it can lead to something called subfertility. And subfertility is basically, there is a risk later on that she can be infertile, but we wouldn't know this, wouldn't be able to quantify the risk just yet. And I would advise that we just deal with each step, one step at a time. All right. The other thing, you don't have to say things like you don't have to worry about it too much, all right? Because it's a patient, it's a family, it's their daughter. They can worry the way they want. Your job here, not to tell them off for worrying about the patient, but basically to give them the right information and to reassure them, right? So saying to someone you don't have to worry too much is not really okay. Boom, I'm not worried after you say that. No, that's not going to happen. So just as a doctor, you need to give me the right information, and it's my decision whether to worry or not as a patient. Okay, that's one thing. The other thing is, when I talked about the consultant, I felt you were a little bit defensive for non-obvious reasons for me. So when I said, well, this consultant operated on my father, and my father died, so I feel like the main reason. All right. So first of all, you don't want to get into that, right? It's not part of your job to get into that. But one, you need to show compassion. Okay, so you need to say, first of all, I'm really sorry about your father and what you've been through. It must be really tough that this happened only 3 months ago, and I hope that you're able to cope with that. And if there's any help that we can offer, we're very happy to. However, I'm afraid I'm unable to comment on this. I was not involved in your father care, and I'm not really sure what are the circumstances of that scenario. That's the second thing. The third thing, the third thing, I felt that you were very comfortable making a decision on your own, which actually shouldn't be the case. So I think you should have said, that I'm very happy I feel that my consultant will be able to answer your question better than me in terms of this operation. So I'm very happy for them to ask them to speak with you. But there is another factor that we need to consider, that this actually might delay things. And at certain point, if we think your condition is getting worse, we'll have to go ahead and do the operation anyway for her best interest, because this is a major concern that some might get into sepsis. And in terms of the discussion with the consultant, it can happen anytime, either before or after the operation. Changing the consultant, again, you were very comfortable saying, well, no, we're not going to change the consultant because I don't think there is anyone around. I think you can, right? But what you need to do is you want to say, well, there is my information that there is only this consultant in today, but I'm very happy to speak with him and ask him if he's able to do that. But of course, like I said, this is going to take longer time and can jeopardize her life. And at some point, if her condition gets worse, we'll have to go ahead and do the operation anyway, either with or without their consent, right? So when you're doing for consent type 2, like you mentioned, if the family are not in agreement and you feel that they're not making a sound decision and you have any concern, it will be the consultant or the medical team decision, right? And they will sign a different consent for the child.